Victoria's coronavirus death toll is unfortunately likely to rise, with more than 100 staff and patients in 32 aged care homes testing positive. Authorities there now racing to avoid a repeat of Sydney's deadly Newmarch house cluster. Federal Minister for Aged Care, Richard Colbeck, joins us now. Thank you so much, Minister, for your time this morning. 19, as we know, died at Newmarch. It was a terribly tragic place, just one aged care home. You've got 32 homes infected across Victoria. How did you not see it coming?
Well, it's a function of community spread, Carl, unfortunately. The aged care workers are not immune to this virus. In fact, the number is now 39. There were 7 new facilities yesterday that I've been advised of this morning. So it is growing. Fortunately, those new 7 are staff only at this stage. There are 8 facilities where we have residents with outbreaks with the virus, and there are 45 residents in those 8 facilities that have contracted the virus.
In relation
there is more bad news coming.
And we'll get to that in a second. In relation to the Manorock facility, who's in charge there? Are you starting to take control of that facility?
The Aged Care Quality Safety Commissioner, my department, and DHHS are very actively engaged with Manorock. We've moved all bar a couple of the positives out who will be moved today.
Right.
To hospital. The issue there is being able to effectively isolate and separate residents so that they don't spread the virus within the facility, but we are very actively engaged with that facility. I spoke to the Aged Care Quality and Safety Commissioner on Sunday and again yesterday. I've been having twice daily discussions with my department at least, and they are very actively engaged with officials in Victoria as well.
I'm glad you're doing that because I'm not sure that the state has had the capacity to deal with this emergency. Are you aware Manorock was hauled before the Royal Commission into aged care facilities?
Yes, I was aware that
and
they
what was
did
the
appear.
outcome?
Well, they gave evidence with respect to some of the issues that they'd had. I've spoken to the manager of the site myself. I rang her the other night. She's just come out of ICU with COVID, had a very tough time. So this just goes to demonstrate how devastating this virus can be once it gets out into the community. And we're working, as I said, really closely with Victoria. I know Greg was talking to Minister Makakos last night. I had a briefing on that meeting late last night with respect to any of the additional things that we might be able to do in conjunction with New South Wales to help protect aged care facilities across Victoria. And, of course, we're talking to New South Wales with the concerns that exist in Western Sydney at the moment with a visitor that went in that was COVID positive. OK,
I'll get to that too in a second. There's a lot happening. The point is they had a Royal Commission. I know how hard you are working. I know how many calls you're making. I know how across this you are. This is not a criticism of you. But there was a Royal Commission and this particular facility in Victoria was hauled before the Commission. So we knew what was happening there. They knew they were being watched. What steps were taken at that facility to ensure an underperforming aged care operation would be safe during this pandemic because we knew it was coming?
Well, it wasn't this facility, Carl, it was the group. It was the Manorock group that appeared before the Royal Commission. Talking to the manager on site, they'd been taking temperature of residents 3 times a day. They'd been practising their PPE drills, donning and doffing, so that they could, if they did have an outbreak, they would be in a circumstance where they could manage it. They've lost most of their staff because all those people who've been doing that work, all that practice, are either COVID positive or isolating and off-site. So the service has been severely impacted in 2 ways. One, a number of residents, at the moment the official number is 15 who have contracted the virus. Unfortunately, one of those has passed away. But they've lost most of their staff because they're either contracted the virus or they are isolating. And so we've got a number of staff in there at a range of levels to make sure that the residents that remain there are being looked after properly. We're having a regular round of testing, so every couple of days we go in and retest everybody because this virus takes a while to incubate. And unfortunately, I can't say that the number that we've got now is the final number because it will take a little time for that to work its way through.
I don't know.
very actively managing the site.
Richard, again, I don't know how anyone has any... You're saying all these things and all these reasons as to why there's no staff. I'm hearing there were staff working at multiple facilities, not just one, but up to 3. There's nurses who have been working not just as nurses, but they've been working in the kitchens to help people out. The people and the residents inside these facilities have been so badly let down by the system, it's unfathomable. We heard from Graham yesterday, a resident stuck inside another home. Now, he was scared. He's terribly upset. He's frightened. He lost a friend of his to this terrible virus. How do you ease the burden and the fears of those people inside those facilities this morning?
Well, that's why we continue to lean on the advice of the AHPPC. That's why on Monday the AHPPC gave us the advice that all aged care workers within the Melbourne metropolitan area plus Mitcham should wear face masks. We put that into force immediately. We then put 4 million masks into Victoria to make sure that we could have that supplied. We spoke to Victoria yesterday, and the conversation last night was that we would extend that out to aged care facilities across Victoria. And we, of course, will then supply the masks from the national stockpile. So we continue to ask ourselves, and we continue to ask the AHPPC and the health officials, what else can we do? What more can we do? And we continue to ask that question because it's important we do everything we possibly can to protect these people who, as we all agree, are extremely vulnerable. I
think you're doing a good job, Richard. Just I hope that you take more control because these facilities are letting people down. We really appreciate your time today. Thank you so much.
It's really, really tough, Carl. Thank you.
I get it. Ali.
Well, as you mentioned, Carl, 83-year-old Graham Smith is locked down in his aged care home. He shared his fears with us as cases rise. He actually lost his neighbour and friend to the virus at the weekend.
A little scared. It brings it very close to home. I was living not far from where I am. And, it was a bit of a shock.
It was heartbreaking listening to him yesterday, and after an anxious wait, Graham has just received his COVID test results and joins us now. Graham, how'd you go?
I came out with a negative result. Really happy.
Oh, yay. We're so relieved because when we last checked in with you there were 12 cases linked to your aged care home. Do you know if that's risen in the past 24 hours?
I think the number of cases is either 9 or 10 staff and 4 residents.
And do you feel that everything's being done right now to keep you safe?
Everything, as far as I can tell from inside my room, is being done. The staff of temperature checking, coming in, they're wearing full protective gear, and I think they're keeping their distance as far as they can, and I keep my distance from them. And I think they are doing everything that they possibly can to control it.
Well, Graham, we are so relieved to hear that your test came back negative. You touched us and so many of our wonderful viewers yesterday because I think we hear the figures every day, but you put a real human face to this crisis. So thank you. You're a great Aussie. You served your country in the Defence Force for 27 years. So to say we love you, keep your eye out for a little special package from us at the Today Show. We're sending it your way. It should arrive later this afternoon.
Thank you very, very much, Ali.
Yeah, well done. OK. Some good news, Carl.
That's great news, and we'll touch base with Graham again tomorrow, I reckon. He sums it all up, doesn't he? And lovely interview, Ali. All these rising cases and emerging clusters, many have now accepted this is Australia's second wave of the virus, but one expert is raising alarm, claiming this surge is not Australia's second wave, it is only the first. Editor-in-Chief of the Medical Journal of Australia, Professor Nick Talley, joins us now. Professor, thank you for your time today. That's incredibly alarming. Please explain.
So, look, that first wave that we had, the March-April problem, was really about international travellers returning and some leakage into the community, some community spread, which I think was largely eliminated by the lockdown. But now in Victoria and possibly New South Wales, it's really a little bit different. We have widespread community transmission of the virus. That's really worrying. That's different, a different enemy. And that's why I've called this the real first wave. The initial wave was almost like a practice. Now we're in more serious territory.
It doesn't bode well, does it? A lot of debate around Australia's approach to the virus, suppression versus elimination. Premiers and our PM think elimination is a little bit too risky, I guess, for the economy. But at what cost will that come to health, do you think?
Well, look, I think it's a really tough issue, but if you just suppress, you're guaranteed to have circulating virus in the community. That's what a suppression strategy does, and that means more outbreaks. If we can eliminate, like New Zealand, like Taiwan, like some other places, if we can eliminate, then we avoid the problem, potentially anyway, of the community transmission and more serious outbreaks. It becomes easier to control. It means the economy can hum along more effectively. I know it's controversial, but my view is, and there are other experts as well who have this view, elimination can be done.